Welcome back to the channel. Today we are going to talk about something very interesting, something that will make you proud but also make you think. We all know that modern surgery is very advanced. Lasers, robots, painkillers, everything is high tech. But have you ever wondered who did the first surgery? Who was the first person to cut open a body, fix something and stitch it back? If you think it was European doctor in 18th or 19th century, then you are wrong. The first surgeon, the real father of surgery, lived in India more than 2500 years ago. His name was Sushruta. And today we are going to dive deep into his life, his work and his amazing book, the Sushruta Samhita. Let's start. Sushruta lived in a city called Kashi, what we now call Varanasi. This was around 600 years BC. Just to give you perspective, at that time the Greeks were still figuring out philosophy and the Roman didn't even exist yet. Sushruta was not just a doctor, he was a teacher, a surgeon and a scientist. He had students, he taught them surgery not just in theory but on dead animals and model fruits. Imagine that, practice on watermelon before cutting a real person. He wrote everything down in a book, the Sushruta Samhita. This is one of the oldest medical texts in the world. And when I say old, I mean older than the Bible, New Testament, older than the Quran, older than the most thing you can think of. And what's in this book? The Sushruta Samhita has 184 chapters. It describes 1120 diseases. It listed 700 medicinal plants and this is one of the most important part. It describes over 150 surgical instruments. 150, that's more than what a modern general surgeon uses today. Now here's where it gets really interesting. Sushruta didn't just say cut here or there. He created a system. He divided surgery into 8 steps. He called it Ashtavida Shastra Karma. Let me tell you the 8 steps but in simple words. First one, Chedana, excision, cutting something out. Second one, Bedana, incision, making a cut to open. Third one, Lekana, scraping, removing dead skin or dirt. Fourth one, Ishana, probing, using a tool to check inside the wound. Fifth one, Aharana, extraction, pulling something out like a stone or bullet. Sixth one, Vishravana, drainage, letting out pus or blood. Seventh one, Sivana, suturing, stitching the wound closed. Eighth one, Ksharana, cauterization, burning a wound to stop bleeding. Now you might think, cauterization, burning, that sounds painful. Yes, but Sushruta knew that. So he also found a way to reduce pain. He used wine. He would give a wine to the patient before surgery to make them less sensitive. That is the earliest form of anesthesia. Modern medicine started using anesthesia only in 19th century. Sushruta was doing it 2500 years earlier. Now let's talk about the thing that made Sushruta truly legend, plastic surgery. In ancient India, there was a punishment. If someone committed a crime or lost the war, their nose could be cut off. It was a way to shame them. But Sushruta saw a problem. These people, even if they were criminals, still deserve to live a normal life. So he invented a method to rebuild a nose. How did he do it? Listen carefully. He would take a piece of skin from a patient's cheek or forehead, not from any dead person, from the patient's own body. That's what we now call a skin flap. Then he would carefully shape it into a nose, attach it to the nose area and stitch it. He even kept small holes for air like nostrils and he covered the donor area with herbs and oils to heal. This technique, the Indian rhinoplasty, was so perfect that it is still used today with very little change. Now here the amazing part, for centuries Europeans did not know about this. Then in 1749, 2 British doctors were travelling in India. They saw a local surgeon from a traditional family rebuilding a man's nose right in front of them. They were shocked. They wrote a report for a London magazine called the Gentleman magazine and that report changed Western medicine forever. In 1814, a British surgeon named J.C. Cardew performed a first nose reconstruction in Europe. Using exact the method Sushruta wrote about 2000 years earlier. So, the next time you heard about plastic surgery, remember Sushruta. But Sushruta didn't just do noses, he did many other operations. He did cataract surgery, removing a cloudy lens from the eyes without microscope, without a laser, with steady hands. He did removal of kidney stones. He described how to cut, find a stone and pull it out. He did obstetric, like turning a baby in the womb if it was in wrong position. He even did autopsies, cutting open dead bodies to see how the human body worked. And the instruments, he made themselves. The Sushruta Samhita described forceps, scalpels, needles, catheters and even endoscopes. Yes, endoscopes. A tube to look inside the body. Modern endoscopes use fiber, optical and cameras, but the idea same. He also talked about suture, stitching materials. He used cotton fibers, animals, sinews and even ant heads. Yes, ant heads. Let me explain. If you had a deep wound in intestine, Sushruta would take a big ant, hold it near the wound, let it bite two edges together, then snap off its body. The ant's jaw would hold the wound closed like a natural stab. Then it would heal. Brilliant, right? So when people say ancient Indian medicine was just herbs and magic, tell them about the ant stab. Now, hear the truth, we don't know everything about Sushruta. Some historians say Sushruta was a one-man, others say Sushruta was a title like family or a school of surgeons. The book we have today, the Sushruta Samhita, was probably written and rewritten by many people over hundreds of years. The oldest version might come from 800 BC, but the version we have today is from around 300 to 400 CE. They're still very old, but it means many people added to it. Also, we don't have a clear portrait of Sushruta. No statues from his time, no painting. All the images you see online are modern imaginations. But does it make him less real? No. The knowledge is real, the surgical methods are real, and that knowledge has saved millions of lives. So even if Sushruta was a name for a tradition, the tradition was way ahead of its time. And one more thing, the Sushruta Samhita was translated into Arabic in the 8th century. From Arabic, it traveled to Europe, so there is a direct line from Sushruta to modern surgery. That's not a claim, that's a history. Now, difficult question. If Sushruta was so great, why don't we know his name? Why do most medical students learn about Hippocrates, the Greek doctor, and not Sushruta? There was two reasons. First, during the British rule in India, the British wanted to show that everything modern come from the West. They sidelined Indian knowledge, they taught their own medicine in schools. Ayurveda and Sushruta work were called folk medicine and scientific. Second, many ancient Indian texts were lost. Nalanda University, which had thousands of manuscripts, was burned by invaders. Many copies of the Sushruta Samhita were destroyed, but some survived, and today the world is rediscovering him. In 2023, the British Association of Plastic Surgeons officially recognized Sushruta as the father of plastic surgery. And in 2020, a statue of Sushruta was installed in Australia, yes, Australia, to honor his contribution. So he is finally getting the respect that he deserves, but it took 2600 years. So friends, what do we learn from Sushruta? We learn that India was not just a land of spirituality and philosophy, it was also a land of science and surgery. Sushruta cut bodies, stitched wounds, rebuilt moves and taught students, all without modern electricity, without x-rays, without antibiotics. He was a true genius. But his story also teaches us something sad. We forgot our own heroes, we let others take credit, and we believe that everything good came from outside. It's time to change that, not with anger but with knowledge. Read about your own history, share it, because if we don't tell our stories, no one else will. If you like this video, please like, share and subscribe. Thank you for watching.